Hello, and welcome to Thriving Together. We are a parenting podcast that focuses on the intersect between parenting and living with a chronic illness. We are your hosts, Holly,
And Jenna.
and today's episode is actually going to be about diving a little bit deeper into Jenna's individual story. We're going to talk about diagnosis and then go all the way through life up until where she is in her parenting journey right now. So we are very excited for all of our listeners to tune in to see if any part resonates with you. We ask that you leave a 5-star review or connect with us on our Instagram community, Thriving Together Podcast. And with that, we're going to start with our favorite question of thriving or surviving. How about you, Jenna?
I would say thriving today. Feeling pretty good today. It's the weekend, so can't complain about that. What about you?
I am actually going to say surviving. We're going to be getting some flowers today for our new house. I think I mentioned
Yay.
on some past episodes here about moving, and we did it. We definitely survived through it. And I think maybe we're going to get a little bit into thriving in our new space, but oh my gosh, that was so much. Just unsolicited advice, always hire a moving company.
100%. My partner and I said that the last time we moved. We are not doing this ourselves again. Nope.
There is absolutely some distorted thought that I could do this, and our little turned out to be sick during the move. So we definitely had some moments where she was just like, Mom, I just need snuggles. And I was like, well, good luck moving those boxes, guys. I'm going to go watch some Peppa Pig.
Perfect.
All right. Well, Jenna, should we go ahead and dive in?
Yeah.
I know that we have, throughout our different episodes, talked bits and pieces about our stories, but we figured today we would just dive a little bit deeper so that our listeners can get to know us and to see if there are parts that really resonate with them. We know that each individual journey is different, and we'll just kind of hear a little bit of what it was like for you, Jenna. So, why don't we go ahead and start with when you were diagnosed? And I know that you were pretty young, so we'll kind
Yes.
of use a bit of from what you remember, but also from what you were told during that time.
Yeah, absolutely. So I was diagnosed at the age of 2. So I obviously don't remember that period of my life, but from what my parents told me, I was limping one day and my parents were like, "What's going on?" So they took me to the pediatrician and he just knew something was up. And he said, "I think she needs to be seen by a rheumatologist." My eyes were also very inflamed. I had uveitis. So between the joint swelling, that there was no injury, there was nothing to any good reason for there to be joint swelling. And my eyes, he came to that conclusion, "Hey, I think you need to be seen." So my diagnosis journey was very quick, and I was very fortunate in that I did not have to go from doctor to doctor to doctor to get a diagnosis. I was just my pediatrician seen it before, and he said, "You know what? I think that's it." So I was sent off to a pediatric ophthalmologist to deal with my eyes, and then they sent me to the rheumatologist to deal with getting a diagnosis. And sure enough, after lab work and things along those lines, it came back out that I had juvenile what's the new word? Juvenile polyarticular idiopathic arthritis. So fancy word for
What a
saying
mouthful.
right. Um, when I was diagnosed, it was JRA. So
Yes.
that terminology shifted, and I'm trying to shift with it. Um, but basically, that's 6 or more major minor joints that are impacted with arthritis. So um, I don't really remember much of my of those early stages. Um, and then I went into remission around 7, so not too much of, like I know I can remember the being out to dinner and, like, crying that my legs hurt, and I would say my shins hurt because
Yes.
I had arthritis in my knees and my ankles, and the pain radiated, and I didn't know that difference. I mean, I was, 5, 6 years old. Um, So, my parents would always call me their weatherman, and I was right every single time. It's never wrong.
I
Well,
like recognize looking back some of the humor of the weatherman. My family used to call me grandma because I would be so stiff in the morning. But looking back, I'm like, no, I didn't like that.
you know, my family, my sisters called me grandma. They always, I mean, throughout high school, they still do. Um, they say I drive slow, um, and I have the joints of like an 80-year-old. So, I mean, I guess the nickname came, but yeah.
What do you remember, Jenna, of the treatment during that, like 2 to 7, or kind of what was told to you? What was kind of your treatment options?
So early on, I mean, we didn't like there weren't biologics.
Mm-mm.
It was really like naproxen. My parents were hesitant, I think, starting on methotrexate. I mean, I was 2. Um,
Oof.
so, thankfully, it was just like the beginning stages. There wasn't a lot of damage there wasn't a lot of damage done. So up until 7, I mean, it was, I, we, I took so much naproxen or NSAIDs that like I would get bloody noses. Like that was the thing that
Yeah.
we had to deal with next. But it did the trick from, the most part. It kept it at bay enough. Um, And then when I went into remission at 7, it was just kind of as needed whenever I needed something. And then I came out of remission at 13.
Oh,
So
what an age.
what an it was really just the cherry on top to come out of remission at 13. And I had just moved into a new school district,
Oh
like, right
no.
before, right? So it was just like all these things. I was like, "Oh, man, that's rough." Um, but I didn't we had to obviously find a new pediatric rheumatologist because I had moved. Um And during that time, they didn't say I was out of remission until I got back with that rheumatologist, and we looked at the numbers and did an exam and said, "Yeah, it's time to make some decisions." And during that time, they we started out on methotrexate. We did oral first, then we moved to the injection, then we did Enbrel, then we did Enbrel with methotrexate, then we went to Humira with methotrexate, and then we moved to Orencia.
Oh yeah.
So we moved to infusions, and I was 15, 16 when we moved to
Yeah.
infusions. So it was really interesting because I was right on that cusp of whether I should be in a pediatric infusion center or I should be in an adult infusion center. And they put me in an adult infusion center. And I'll tell you what, it is not sunshines and rainbows over there.
No.
They don't have coloring books on standby or
No.
Chalkly. So
You just get lots of pity looks and invasive questions of why are you here?
yes, and that was a lot of it, like, there were some old folks there, right? So people would walk by my room and, they'd be like, "What are you doing here?" "Oh, I'm here for an infusion, I don't know about you."
Yeah.
But, like, I remember going in, and so in the adult, they had chairs and a couple rooms have beds, so in pediatric, they have beds. And, like, I know, like, those days I would walk in and be like, "Come on, I want a bed." And I would be so excited when I would get a bed. But I was always a really tough stick. Um, so usually, like, it would 2, 3 nurses would come in and, we'd finally get hooked up and,
And that's
either, like,
tricky
with
too because
or
your staff is not a pediatric staff.
no, they're not. And so they would have to go over and get pediatric needles
Yeah.
because I have small veins, they roll, they're deep, they blow. So I've always had
Hmm.
issues with like, okay, we might be in, but once the infusion starts rolling,
Yeah.
they start pushing flushes, we start to have an issue of, okay, it blew. And it hurts if you've ever had an IV blow and the tissue gets infiltrated, it
Ugh.
it is uncomfortable. It
Yeah.
is, like, hard as a rock, so, like, usually they'll get you here, and it is, like, really a goose egg, and it is hard as a rock. Um, so, like, it hurts,
And
and I was
tell
not a
us,
fit.
Jenna, if this was part of your experience too, but I feel like in those moments, you're also getting these directives of everything that feels counter to your nature, where they're like, stay still,
Yes.
don't move as you are in excruciating pain, not
Yes.
to mention a child.
You
This
know,
is a really hard to like override your instincts of I'm in pain, I need to get away.
yeah, and a lot of people forget that a 15, a 16, 17-year-old, they're children, right?
Yeah,
They are sure they look like adults,
sometimes. And
sometimes,
sometimes we're really good at talking with adults, like chit chats in an infusion room. But when it comes down to it, you were a
we're kids.
kid.
You're just a kid, and, you know, I didn't need to hear the "stay still," the "don't move," like, it's hard.
Yeah.
You're like, I've had, we're on my 3rd IV placement today, like, I'm tired. Like, and I don't know how if you experience this too, but, like, my academics were really important, and it didn't matter if you had an infusion until that Benadryl kicked in, you were doing your homework, like,
Oh,
if
yeah.
you were missing school, you were getting stuff done, or you were studying for a test or writing a paper, and it's like, most kids that I grew up with did not have to be typing up a paper in an infusion center, or they weren't studying. I mean, I remember my nurses would be sitting in there helping me with, like, a biology class. It's like, I mean, great to have experts here, but,
Oh
you know,
my gosh.
it's
No,
just
you're
that
bringing me back right now, Jenna, to like trying to type with an
with
like an
the
IV in your hand, and what a
and
weird feeling that is.
yeah. Or, like, so sometimes when they would blow in my arm, they would do it in my
Yeah.
AC, so in your elbow, and then, like, you can't move your arm, so you're trying to type, you
No.
gotta keep your hand extended, um, but it
Can
was
you Oh,
really quite
sorry. Can
funny.
you
Go ahead.
remind our listeners too, especially those who may not have had an experience with an infusion,
Mhm.
about the amount of hours we're talking? Because
Yeah.
when we are talking about an infusion, there are infusions that are pretty quick, but most of the time we are talking about a pretty big time commitment,
Yes.
including the time to get there, depending on your location.
Yeah. So, I've been on infusions where I was there for 4 hours, I've been there for 6 hours, and I've been there for 8 hours. It really
Oh,
depends on the medication, it depends on how backed up pharmacy is, it depends if there's a saline shortage. Um, you know, I lived about 45 minutes away from my major hospital network, and that's where I would go in for my infusions. Um, so it was a 45-minute ride there, 4 to 8 hours depending on did I have a reaction, because sometimes reactions happen.
yeah. You have to
Um,
stay for observation.
you have to stay for observation. If my blood pressure jumped or if my heart rate was too high, you had to stay. Um, Something like Remicade, I spent time on Remicade, and that is a very slow infusion because they have to titrate up. So it's like
Yeah.
30 minutes at this speed, 30 minutes at this speed, and it's a little bit longer of an infusion. It gets infused over a longer period of time. Um, and those days you're just there. So as a kid at 15, 16, 17 years old, you would miss an entire day of school. You maybe had the morning if you got an afternoon appointment, but you missed majority of the day, meaning your parents also missed work or your caregiver missed work. Um, and
It's a huge commitment.
it's a huge commitment because
Yeah.
they're not serving you lunch during that either. Somebody has to go out. You have to make sure. I mean, I don't know about you, but I had in my infusion bag. Every month I had it ready to go. It had my blanket. It had a pillow. I had my snacks, headphones, chargers, coloring
Yeah.
books, like things to keep me entertained during those. Because I had a lot of anxiety before infusions. So I'll be the first to admit, I'm not fun to be around before an infusion. My anxiety is through the roof.
Huh.
Everything puts me on edge. So like I always had my bag to go, things that could keep me calm. Um, but yeah, it's just a long day.
Absolutely. Yeah. I'm kind of marked, Jenna, by the first part of your diagnosis, that 2 to 7. So much of that is really in the control of your parents. And then at age 13, you kind of knew about these things, but that was actually really your first experience with being a more of a participant in your diagnosis. What was kind of your looking back now perception, especially maybe as a mom yourself, of how your parents handled that stage between 2 to 7?
You know, I think as a once I became a parent, it definitely shifted. Um, I think that before having a child, it was, "Okay, well, why didn't you just do it? Why couldn't you just do this? Or why didn't you just do that?" And I never took into account the feelings that they had about this
Yeah.
either. Like, being a parent now, my son is the same age I was when I was diagnosed. I could never imagine having to give him methotrexate and watching him like, having to pin him down for that and
Yeah.
do the injection and then, deal with the side effects afterwards, like, that has to take a toll on you as a parent. I think, not knowing the feeling either, like, makes it a little bit harder. Like, if I had to do that with my child today, like, I know how he would feel, and that breaks me on the inside. Like, I think that had to be such a hard decision. Do you do this medication at such a young age, risk any what complications there may be? Like, arthritis wasn't well understood when I was diagnosed. Like, we had an understanding, but, like, there weren't a
Mhm.
lot of medications. There wasn't this, "Here are all the
No.
dietary things you can do, exercise," like,
We were
it
really
wasn't
at that cusp of
we were
methotrexate was like the cutting edge
it wa
thing.
it
And how
was.
scary, right, as a parent to be like, hey, your kid doesn't have cancer, but we want to give them a chemotherapy drug. And there's so much negative connotation with that. And the side effects of methotrexate are severe. I don't know if you had negative reactions when you started, but when I was on it, I would throw up like clockwork
So
every single morning.
yep,
Yeah.
and I lost they had to pull me off of it at one point. I had lost 30 pounds on methotrexate.
Wow.
I couldn't eat. I threw up everything. We had to go on to, like, a gluten-free diet, um,
Yeah.
and it was just methotrexate was horrible for me. I mean, it worked, um, but at one point, they're like, "Okay,
Yeah.
we're teetering to an unsafe zone. I think we need to pull back on this," and they did. But I couldn't imagine having to make those decisions even, as a parent, even of a 13, 14, 15-year-old kid, like,
Yeah.
that's
Yeah.
still tough because, when I was 2 to 7, like, there wasn't a lot of knowledge. They
Yeah.
didn't know what my future looked like. Did that mean that
Hmm.
I was going to be, you know, permanently disabled? Am I gonna have severe joint deformities? Was I
Yeah.
gonna need multiple surgeries? Like, that was so unclear, at diagnosis, and I think there was maybe just a sigh of relief when I went into remission
Yeah.
at 7.
Oh, I imagine.
Um, and then when I, came back out at 13, we had a little bit more information. Biologics were on the scene, and, um, I think that, made a difference, but, like, I still feel like, you know, um, I couldn't have children, and part of that, methotrexate can impact fertility, um, and, like, those conversations were not had, and I don't hold resentment on that anymore, like,
Yeah.
no one they didn't know, like, no one made a intentional decision to put me on that and, you know, that be the outcome, but I think that it bothers my mom the most, like, not feeling like she had enough knowledge in that situation to be making
Yeah.
decisions to help future me.
Yeah. I'm kind of struck by, as a parent, like being in that spot of having to really prioritize which one of these really important things do I have to prioritize? Do I want to prioritize my kids like pain and I don't want them to be pain? So that maybe looks like this medication, but this medication comes with horrible side effects. And you're totally right. I remember being at a JA conference and a parent asking, hey, what is the implication long term, fertility wise, for these kids that have been on methotrexate for years?
Years.
And the answer was just, we don't know.
Yeah.
And we really are part of the generation where we're kind of like in that spot of we were exposed to methotrexate long term, we were exposed to the biologics, and our diagnoses and our treatments were different than the generation that's just like a step ahead of us, and the implications that they had. They still are kind of studying us, to be honest, and to figure out like what was the implication. so that they can be better informed for the generations they are now. And we are so thankful that, if our kids were to have arthritis, we would be equipped with so much more options and knowledge that we would be able to make some really good, best informed decisions. But looking back, almost 30 years ago, our parents did not have that luxury. And now, as a parent, we can extend that perspective. But in that moment, we also are just like that part of the kid who is like, gosh, I kind of wish that you would have done this when I didn't really have a choice, because maybe I would be able to go to the sleepover or go to a dance class and be more aggressive at the beginning so that I could have had these chances now. Or I can imagine even being 13, 14, 15, that there are times where we kind of wish like maybe I could have went to that dance camp. Maybe I could have just like went to the sleepover, but instead I did make the choice to, continue with the infusions maybe longer than what you would have. When you look at your history, especially kind of before age 18, were there moments that have kind of come up for you like that?
Yeah, I I always wish I did a lot in my teen years, but I wish, like, I wasn't so scared to do so much. I am a serial planner. Like, I need
Yeah,
to know the contingency plan on everything, and, um, like, I had to make decisions. If I'm taking methotrexate today, that means that I can't do anything these next 2 days because I'm gonna be throwing up. And that means, okay, don't plan any activities with your friends, you're not gonna go out, um, you know, having to prioritize your health, and I wish sometimes I didn't think that hard about it, um, but and I mean, hindsight's 2020, can't do anything about it now, but,
yeah,
yeah, I think my mom was a big help. Like, my mom pushed me, my mom said, "You're not gonna let this stop you." So she pushed me, she made sure I did the things that I wanted to do, but, there was a lot of, like, strategy behind it, and I know through, like, probably, like, 16, 17 years old, I was like, "Oh, I don't wanna do these infusions anymore, like, I'm over it," and I wanted to
yeah,
stop. They're like, "You're not stopping. You have active arthritis, like, what are you talking about?"
yeah,
Um, like, those, like, teenage rebellion years, I'm like, "I don't wanna do this." I still don't wanna do it, but I do
right.
it. I just had my infusion on Friday, and I didn't wanna do it.
How about what your diagnosis started to look like as you entered adulthood?
Yeah. That was a big shift.
Yeah,
Um, so I entered adulthood, and they said, "All right, well, you're 20 now. You need to go see an adult rheumatologist." And I was like, "Are you sure? Are you sure you
yeah,
can't hang with me for the rest of my life?" And they said, "No, you need to go see an adult." So I transitioned into adult rheumatology. My mom's not coming with me to appointments anymore.
yeah.
Um,
A whole new person, right? Because the one before you had really been able to establish rapport and trust with. Like, it is hard to switch a rheumatologist because
it was really
I
hard.
imagine we all have had an experience with a not so great one, and
Yes.
we don't really get to pick. There's not a lot of options. So you kind of just get assigned.
Yeah, pretty much. And, I showed up, and it was such an interesting switch because when decisions for medications were made, my mom had a heavy hand in it as well. Like, she was the adult. Um, and now I have to make a decision. They're like, okay, so do you want to do this? Yes or no? And I'm like, oh. And as bad as this may sound, like, I realized I can't blame her anymore for
Yeah,
the side effects of these medications. And not that she deserves to take that blame, but I think as a child, it was easier for me to say, "Well, you said we're gonna do this, so this is why I feel like crap."
yeah,
Versus now I'm making these decisions and I need to weigh out the impact. Okay, am I making the right decision? Am I being too risky? Am I being too conservative on treatment? How is this gonna impact me in the long term? And it was, I think, a lot more than I anticipated. Like, I don't know if I realized to the full extent until I was in adult rheumatology how much my mom took on the brunt of.
yeah. It's such a hard decision to weigh out. It's when you are considering switching a medication, there's that question of, well, is our current treatment working? And having to decide, okay, well, Is where I am at right now actually good enough that I want to stay on this? Is it this level where I do want to switch? And if I do shift, then I have to expect things to get worse for a while. And then it takes 3 months to build up to even decide, did this new thing actually work? And then to switch again or to ride that decision out, we're talking about at least a 6 months commitment every time we consider a medication change.
And they often want you to stay out longer than 3 months. They really want to see, like, 6 months. You're al sometimes, you've lost a year of
Yeah.
treatment just trying to figure out if it's the right treatment.
Yeah.
And that's the hard decision is, like, the grass is not always greener on the other side, like,
Yeah.
you're like, "Yeah, this isn't this medication, it's working, but it's just not doing enough, like, I need to be able to do more," and you switch, and then you've regressed for an entire year, and you're like, "Man, like, what did I do?"
And
Um,
sometimes you don't get to go back.
no, you don't, sometimes you don't, and, so, we moved to, um so the reason we had to switch to adult rheumatology, outside of my age was I had been moved to Actemra, and
Mhm.
I had a bad reaction. Um, and, that happens sometimes when you're on infusions, like, your body just doesn't agree to something, and that's that. Um, and I had, pityriasis rosea all over my back, which is, like these red spots along the nerve endings. It kinda looks like a Christmas tree.
Wow.
And it was uncomfortable. And then I developed ulcers down my throat and in my stomach. So it was like it
I'm
was
going to pause you, Jenna. Let's actually uncomfortable, I feel, is surface level to what that probably was.
yeah, it wasn't great. Like I was chugging Pepto, and this was my first year at college. It was my first semester, and like so I'm living away from my parents. I'm using a cane at this point because I started having muscle weakness in my leg, and like I have ulcers. I feel horrible. I have an
So
8 a.m.
scary.
Yeah, I have an 8 a.m. calc class, Calc 2, and I have ulcers, and I'm like, "This is the worst thing ever."
This is
And
not what college is supposed to
no,
be. We are supposed to be like checking Pepto because we had a binge drink, not because our medication is giving us ulcers. Oh my
yeah,
gosh.
it was rough, like, that first semester was it I moved home after that, I was like,
Yeah,
I the beds were uncomfortable, like, I couldn't eat half the food there because I had to be on a gluten-free diet, and that was before, like, gluten-free was, like, like, a thing.
right. It wasn't
So
accessible.
it was not accessible, like, your options were some really bad pasta, or a very firm piece of bread, and it was, like, stale firm.
Yeah.
Those were our options, unless you had meat, and then you had to hope people didn't season it with anything. So those were all your options. Um, yeah, so then, I went into adult rheumatology and they put me on Remicade, and I did really well on Remicade for a while, and then it stopped working, and, um, I
I'm
was
curious, Jenna, if the decision to also move home in college,
that was tough.
was there maybe like a piece of shame that kind of came up too, right? Like sometimes with arthritis, we actually kind of pride ourselves with how well we are able to mask it and be invisible with it. But when you have a roommate, when you kind of feel like you're stuck in a fishbowl, which to be honest, honestly, freshman year feels like everyone is staring at you and there's no privacy. I wonder if that was an element there.
It was. It was, they knew about it, so I lived in a quad, so we had 2 rooms and a living room, and it was a quad. So there were 4 of us, and they knew about my condition, and, it's not something that I typically hide. I'm pretty open about sharing it. Um, but they are also freshly 18-year-olds. Like, we're all basically children still. Um, and they didn't fully understand all the complexities of that. Like, I can't go and drink out of the same bottle you just drank out of. Like, that'll hospitalize me, please.
Yeah,
And then, like, I went home for that weekend for an infusion, and then I returned pretty sick. Um, and, like, there was this sudden shift, like, "Okay, I'm walking through the dorms now with a cane," and I've never had to use a cane before that. So there was, like, this, like almost pride element of it, like,
Oh,
of, like,
for sure.
not people really staring at me, like, I have to walk around campus, like, I just wasn't doing well, and, I didn't tell people when I left college, I moved home, I did not tell people. I didn't want people knowing that I left, like, I was so, like, ashamed that I just couldn't do it,
Yeah.
um, and that doesn't mean, like, I still continued on with classes, I couldn't live on campus, like, it just was not accessible enough for me, it wasn't worth the additional risks that were gonna be needed there, like, I can't rely on roommates to be there in case something bad happens, like, in case I have a reaction or I have, there's something going on, like, that's just it's not fair to them, and it wasn't fair to me, but yeah, a lot of shame during that.
Yeah. That would be such a tough choice to have to prioritize your health, which you had to do, but you also had to give up so much of that normalcy of what happens at 18, 19, 20.
Like, I did not wanna be moving back in with my parents, but, like,
Yeah.
still to this day, unless it's an auto injector, I can't give myself an injection, so I was still
Yeah.
gonna go home and have my mom do it. But,
Yeah.
yeah. So, once, once I came back home, played around, spent time on Remicade, did well on Remicade, um, and then we said, "Alright, well, my ESR, my CRP, so my, inflammatory markers were climbing," and they said, "Alright, we're pretty high, like, I think we need to consider a medication change." Alright, yeah, I don't disagree with that, and at this time, I've been with my partner for 2 years this time, so they put me on a newer medication, and I went in for that infusion. Josh, my partner, attended with me, and I started getting really sick during this infusion. I was throwing up during it. I developed like a cough, and my heart rate was pretty high. Um, they said, you're good. Go home." I was like, "Okay, no problem." Like, not thinking anything of it. Like, it's a new medication. It was going to be
Yeah.
harder on. And I went to bed that night. Still wasn't really feeling that great. I woke up that next morning, and my whole body hurts. Now I have fibro, so like my body hurting isn't like something crazy, but this, like, my clothes touching my skin was rough. Um, just like sitting, it it was tough, and I was like, "Man, this isn't right." And I messaged my manager that day at work. I was like, "Hey, I gotta sign off. Like, I don't feel good." And so they're like, "Okay." And I went to Josh. I was like, "Something's wrong. Like, my body felt heavy. Like, I was having a harder time starting to, like, move around, and just, like, I truly, my clothes, like, I thought I was gonna scream. So I was like, "We need to go to the emergency room. There's something is wrong." Um, and we got to the emergency room, and, we went to the emergency room of the hospital that my infusion was done at because they have all the records there. It's just
Yeah.
easier. And, sure enough, like, they pull me back into triage, and anybody who's been to the hospital knows you go into triage, they triage you, and then you go and you sit for a bit. That was not one of these situations. They put me back, they took my blood pressure, it was sky high, my heart rate was really high, and they're like, "Oh, this is an emergent situation." I was brought straight back into a room, and I was seen immediately. Um, and during that time, I went up to go to the bathroom, and I was like, I can't really walk. Like, my foot is dragging kind of behind me. Like, I'm having a hard time picking it up. And I couldn't keep it up. It's like, man, something's up. So, um, they're like, all right, well, we think this is an infusion reaction. We asked the on-call rheumatologist to come. Like 5 hours later, they show up.
Oh no.
Yeah, yeah. Because they don't usually get called to the emergency room. They didn't know what was up. But that's okay. Um, and at this point, like, I'm not able to use both my legs. Like, I
Yeah.
can't pick up my legs. What is going on? Like, I'm starting to get panicked. And they're like, the rheumatologist came in. He's like, I think it's a UTI. And I was like,
Oh no.
you're crazy. You're crazy. It's not a UTI. I know it's not. And sure enough, before they would do anything, they made me, do a urinalysis, and of course that came back normal because I knew it wasn't a UTI. And then, after that, they just said, "Okay, well, we're gonna admit you." And I said, "Okay." And, it was during COVID, so everybody, like, physicians
Yeah.
were fatigued, the whole medical system was just burnt out at this point. And, ultimately, they sent me to rehab, and we didn't get a diagnosis, we didn't know what was going on, it wasn't treated. And, um, then we went to Johns Hopkins, it's the number 1 rheumatology clinic in the country, and we did some testing, and I had Guillain-Barré syndrome. So, that's ascending paralysis, meaning it starts in your toes and it works its way up, um, and you just lose complete control of your body.
Yeah.
Um, and it was really hard because I think, my biggest fear leading up to it was, my biggest fear in life was I was always scared of having to be in a wheelchair, and I now being in it, it is what it is, like, it's not that big of a deal. But prior to that, like, I was so concerned, like, what does what does my life look like? Like, what changes do I need to make? There was a lot to it. Like, I feel like
Right.
any wheelchair user would agree to that. There's a lot more to it.
Absolutely. Especially, I'm really marked, Jenna, about when it comes to arthritis, there is a little bit of this sense of I'm really worried that eventually my body will progress to a point where it's beyond a point where any medication can intervene. And what a terrifying moment with this diagnosis where your fear was actually happening of
Yeah.
slowly you were losing function of your
Mhm.
body. And I can imagine how terrifying that was. And I'm curious, at that point throughout this, was your partner with you, or did you have to be solo because of COVID restriction?
Yeah. Um, so part of it, I was able to be, I was able to have Josh with me, and then in the hospital, and then we checked into the rehab. And at that point, all rehabs and skilled nursing facilities shut down to anybody but the patient. And that was hard because I'm paralyzed by myself
Yeah.
in a room by myself because we weren't even allowed to leave the room for therapy. The therapist came into the room to do it, and of course, they're gowned glove and face shield. So like
Yeah.
you you didn't get to talk to anybody really during the day unless you were like FaceTiming somebody or calling them. Um, like there was no physical touch. Like I didn't get to hug anybody for maybe a month and a half. Like it was crazy. But my mom and Josh would drive 45 minutes and they would park outside my hospital window, and they would call me and they would just talk to me for like an hour and a half. And like it made all the difference.
Yeah.
And it just spoke to like the level of love that they had. Um, but it was really tough. And then at one point I learned that if you can get a therapist to sign off saying it's impacting your mental state, they will allow one companion for 1 hour a day. And I couldn't tell you how fast I had that note written.
Oh my gosh. Why
And
is that even necessary?
I don't know. I think it was a formality at that point, but it was so crazy. But when Josh came in, he was gowned, gloved, and a face shield, and like a mask and a shield.
Yeah.
And like we weren't really like you weren't allowed to hug, but like I hugged. um,
Absolutely.
but it was like this crazy period, and like like they weren't he wasn't allowed to be there. So usually when you're leaving or transitioning out of a physical rehabilitation center, you have your family come in, people who are going to be there with you
Yeah.
majority of the time to learn, okay, this is how transferring works, and this is how going upstairs works, and bathroom time and
Yeah.
things like that. Like there were a lot of things that needed to be taught, and usually they do a home visit so we can make sure that the house is accessible. Well, we couldn't do that for reasons, COVID reasons, and um, you know, I I went home, and at this point, they had not diagnosed that it was GBS, so I wasn't treated. So I was just still paralyzed.
Right.
And, they sent me home, and, like, I wrote an email, I was like, "I can't believe you've sent me home, like, this is crazy, like, I can't even access my bathroom in my house." Because my
Yeah.
house wasn't accessible at that point, like, we didn't consider it, we didn't need to at the time when we purchased. Um, so, like, it wasn't accessible, and then they were like, "Okay." And then when we went to Hopkins, we got the testing done. Um, I ended up at a different hospital system, and we did another round of testing, they agreed, then they treat it, and then I ended up in rehab again, and I was discharged from the rehab hospital 2 days before my wedding. So it was quite stressful time, and I was not moving my wedding again because I had to move it the first time because of COVID, so I was like, "I'm not doing this again. I will crawl down that aisle if I have to. I will be there."
Yes.
And, I had just the best staff there at the second rehab hospital, and, um, they got me up, they got me in, leg braces to help me with standing, and, um, I was able to walk down the aisle, I was able to dance at my wedding, so overall, that was a success. But the aftermath of all that was there was no way I was going back on an infusion. I was traumatized. Um,
Absolutely. And we're not using that word lightly here. We actually mean that this was traumatizing. And I'm also really just going to give you some recognition here, Jenna, for advocating for yourself rather. I mean, essentially, the first hospital was like,
yeah,
sorry. And being able to advocate of this cannot be normal. This cannot be
no,
where our story ends. And you
yeah,
had to really push forward for that. And of
yeah.
course, this is a situation that has really shaped your decisions going forward.
Yeah, it has, and I remember saying I said, "I was a healthy 23-year-old woman before
Yeah.
this infusion." I said, "And overnight, I was paralyzed. You cannot tell me that's normal." And I
No.
mean, I pitched a fit. I was not having it.
Yeah.
I was not gonna hear any excuses. I was like, "This doesn't make sense, like, make it make sense to me."
We're going to
And
challenge that you pitched a fit and say we had a normal, reasonable reaction to a insane situation.
you know what? Fair. I'll give you that. That's fair. But it was just wild, and so between, Remicade and that other medication, I had to have a port placed, because they couldn't access my veins anymore, and,
Yeah.
that was a godsend because
Yeah.
being in the hospital for as long as I was hooked up to things, and I would have been a pincushion, during that period if I didn't have my port, so that was helpful, anyway, so well, I'm not doing infusions anymore. I go on this whole spiel. It's not happening. I'm not doing it. I'm not taking this risk again. I just got my legs back. Nope, not doing it. So they're like, okay, well, your port has to come out because it could clot if you leave it in. I'm like, all right, no problem. I'll make it through surgery. Had a whole panic attack prior to that. I was like, I don't want you coming near me. Like, I don't want to be in this hospital. I don't want anything to do with it. Um, and they're like, so we take it out, and I get through that, and I finally heal through that. And I probably stayed off meds for a year and a half.
Yeah.
But unfortunately, I was not in remission. So I had to make the decision to go back on infusion medication. And I said, okay, if we're going to do this, we're doing it on my terms. And they said, okay, fair enough. And I said, we're going to go back on Orencia. That's what I feel comfortable with right now. I'm willing to give Orencia a try. At this point, it had been long enough between that they felt that
Yeah.
it could be effective, and thankfully it was. But with that being said, I needed another port. So, like, all said and done, I've had 6 port surgeries,
Yeah.
because I had to have it placed, and then there was an infection, and they took it out, and they put it in, and, so, you know, I go in, we have that done again, and that first infusion, I mean, I that first infusion back was really tough. I think that was it was one of those situations where you really just wanna run out of the building, you
Yeah,
wanna get as far away from it as you can, but you know you can't, and you have to just
yeah.
try to
You're literally having to override your
yeah,
amygdala that is telling you
yeah,
everything about this feels unsafe and just go get safety. And that like goes all the way back to like when your veins would blow when you were like 14 and you're being told just stay still, where part of being a good patient is really being able to override our instincts of this is painful and scary.
yeah, and, so I pushed through that. I mean, Josh was there with me for that. I did so much therapy leading up to that because I had to figure out how am I going to stay there? How am I going to push through
Yeah.
for 4 hours at an infusion center with the IV pulse beeping and the beeping is like that one. I have to wear noise canceling headphones if I'm doing it at an infusion center because the beeping really just kind of sets me.
Hmm.
Uh, and like so you hear that and the smell of the alcohol swabs and there's just
Yeah.
like it's just like when it's a traumatic response, like it just your sensory is like overloaded. Like there are all these different things, like
And there's
the
so
feel
much
of
of
the
a
shoes.
sensory component to anything in like in the medical realm.
Yeah,
There is the smell, there is the sight, there is the sound, and that really gets heightened.
it does. And so I make it through that infusion. I'm so scared that like following week I'm like, please don't do it, don't do it. And I make it through. Um and then they made me do one more infusion at the infusion center. And then one thing I advocated for is I wanted home infusions because at home there was not the IV pump beeping. They can do like a gravity drip, and we were able to do that. So like I was able to be in the comfort of my home
Yep.
with like it's one-on-one care. It's like I don't have those sights, the sounds, the
Yeah.
smells, like those things I was able to remove, and it helped a lot.
Yeah.
Um, so once that was under control, and you know I was dealing with issues with you know my period and things like that, and trying to get pregnant, couldn't get pregnant, all that good stuff. And they made the decision that it was probably time. I needed multiple iron infusions and things like that. And they said, we've tried everything to help stop this. I think it's time to have a hysterectomy. And that was a tough conversation. I was 25, 25
Yeah.
years old. I have to come to terms with, okay, you're not going to have a baby biologically. And, um, And that was okay, I came to terms with that, but what does surgery look like? What does recovery look like? I am prone to infections, like, the second I have a surgery, I'm like, "Alright," they're like, "Yeah, here's an infection." Um, and at this point, I had a 4-month-old, so I'm really, really nervous. Um, so from the time that Jace came home to where we're at prior to this, hysterectomy, like, I had to come off meds so we can prep for the surgery. Because they were really concerned about reducing any risk of infection and taking it off an immunosuppressant would help. So I came off and we'd have the hysterectomy and then now we're going back and this is my first infusion now after having a baby and having a child that relies on me. And now it's this whole new fear of okay, I have to have this infusion and it's not just my partner that needs me. I have a child that relies on me now, and it's like this whole different level of anxiety. Like, I
Yeah.
don't know if you felt that, like, once you had your little one, like, did you feel this, like, anxiety of, like, "Oh my gosh, like, this needs to work out?"
I definitely felt like there was a new pressure of I have to take care of myself because health is not a luxury that I can afford. Like I have to be healthy all the time. I can't be having flare days. I can't be having these days where I'm sore. So there definitely was a bigger pressure I felt of trying to be the best, like arthritis version of myself. Yeah. And I don't know, maybe if you felt this too, or if it was harder actually doing the infusions in home with the baby. But I actually eventually decided I couldn't do infusions because of the time commitment. And I like was able at the time to just switch to the at home pieces, but trying to find a babysitter for those 4 hours. And I was like, well, can't I just bring her? She's a baby. Like, I'm fine. And they were like, no, because if you have a reaction, we
Yes.
can't take care of her. Like, you can't bring her. And so that was a factor. So I'm curious of how that kind of looked for you guys with being in the in home.
Yeah. So, my mother-in-law, she's retired, she doesn't work, so she was able to come over and take care of him while I was having my infusions downstairs. I mean, he was like, 5 or 6 months old at this point, so he could play upstairs in his room, and he had his crib in there,
Yeah.
so, she was able to put him down for naps, and I was very fortunate in that sense that somebody was able to
Yeah.
keep an eye on him while that was happening. But now today, I have I have my infusions during the day, so he is at daycare during that time, so
Yeah.
I know he's safe, and then, my partner can pick him up afterwards because I can't drive after my infusions. My pre-infusion regimen has a lot of Benadryl in it, and, um, and it knocks me out, so I would not be able to legally operate a car. So he picks him up, and he usually takes care of him that evening because 'cause I'm usually just not feeling that great afterwards,
Yeah.
but, um, it is different, and it is a huge time commitment, like, I'm about to switch jobs, and knowing that, it's like, what does that look like in a new role, in a new company? Like, am I gonna be able to take the time that I need off? Am I gonna have to take breaks? Like, there's a lot that you don't think about until you have to.
Yeah. Absolutely. So many of those different factors. And going through those experiences, Jenna, where you had to live out some of those consequences, of course, you're going to really weigh out those decisions going forward.
Yeah, and I do. I don't agree to anything, when I'm at the doctor's office anymore. I like to sit out back and think about it for a
Yeah.
couple of days, and then I message back. I just It gives me a little bit more control of the situation, and I find that comforting. So
Yeah. Where would you say you are with arthritis right now in our current?
so I'm not in remission. I definitely have active arthritis. It is managed. I'm back on Orencia, and I'm staying on Orencia right now, and it seems to be doing the trick. Um, I think the only thing that would change is if we were to see joint damage or deterioration happening. Um, you know, I think it would take a lot for me to switch at this point. There's a lot to it. It's a complex decision, but right now I'm surviving, and that's right now that's good enough for me.
Yeah.
Yeah.
Is there anything else as you look at this kind of intersect between parenting and arthritis where it is right now, where it's kind of coming up for you, or maybe in a positive or negative way? How is arthritis affecting parenting in the season of life you are right now?
I would say it has helped prepare me to be prepared. I
Yeah.
am so diligently prepared for everything. Like whatever he might need, I have it. I've already thought of that contingency plan. Um, and I also think it's teaching him empathy as well,
Yeah.
and compassion for others and understanding of others. Um, I think I'm starting to see that where, he came home. So I had my infusion on Friday. He came home from school on Friday, and they were just about to deaccess my port. And, he like kind of was looking, and then he came and he rubbed my leg, like he just kind of patted my
Oh,
leg. Like you can tell, like he understood that something was going on. And,
yeah.
I think that probably wouldn't happen if he didn't have to experience those. Okay, hey,
Yeah.
mommy, mommy wants to get on the ground with you right now, but she can't. So why don't we play together here, or do you want to
Yeah.
do this instead? And kind of explaining it in a kid-friendly way what arthritis is. Um, I don't know if he would have that level of empathy and compassion.
Yeah, it sounds like actually arthritis has allowed some of that heart connection to deepen even more and for him to really express that love towards you and for you to be in a place where you receive it not as like, oh, my kid is pitying me, but
No,
like,
yeah. I
and
mean, I
it's
might have
like,
felt that, but that's okay. I was willing. we're in that two-year-old stage right now
Yeah.
where it's like we want, yeah, I'll give you hugs, but on my terms. And
Yes.
I was like, I'll take this. This feels like a
Yeah,
win.
absolutely. We'll take the wins.
You'll take the win.
Jenna, thank you so much for sharing your story today. I think anytime we have the courage to be able to share our authentic and vulnerable self, there can be so much hope and validation that other people feel too. And that is really our hope when it comes to our podcast in general, is that our listeners are able to feel like maybe they're not so alone, or especially when we are only really given that version of the story of, oh, well, I had arthritis just in my finger and then I went into remission and I'm totally okay. But being able to hear, there is a spectrum when it comes to arthritis, and hopefully others are able to really resonate with what was said here today. Again, listeners, if anything does resonate with you, we really appreciate a share or a 5-star review wherever you are listening. Connect with us on our community Instagram page, Thriving Together Podcast. And we are really excited for next time. We're going to continue to dive a little bit deeper, and I'll share a little bit about my side of my story. And we are just looking forward to a summer of connecting with you guys.
Yes. Thanks for listening.
Bye.
Bye.